Get started and respect everyone's time today. First of all, please make sure you're muted if you're not speaking. I'd appreciate it. I want to thank you all for being here with us today, especially this group. I know you all have had a particularly rough time during the COVID-19 crisis and done a lot of innovative things to keep our community fed. And, we at the Chamber are really appreciative of that. This is the industry town hall that we're conducting on behalf of the restaurant industry. My name is Corey Atkins. I'm the Vice President of Public Policy and General Counsel for the Asheville Area Chamber of Commerce. Let me first express appreciation for all the level of collaboration that we've seen between the public and private sectors during this crisis. It truly has been one of the silver linings of the moment, in my opinion. And the town halls we're holding today and the ones we held yesterday are an example of how we've worked together. But first, before we begin, let's talk a little bit about what your expectations can be and what this meeting is and what it is not. This meeting is about giving the health department of Buncombe County the opportunity to listen to business owners about your ideas and best practices around safely conducting business as we continue to deal with COVID-19. It's also a time for them to hear about the things that you haven't figured out yet, whether it's where to obtain masks, shields, gloves, other PPE, and how to ensure social distancing is accomplished, or any of a myriad of a number of host of issues that business people have to deal with when operating during this pandemic. What this meeting is not, it's not a time to lobby the health department about whether or when we should reopen or not reopen. And you're not going to come away from this meeting, unfortunately, with a deadline for when you should prepare to reopen either. And let me make that clear. There will not be a set deadline at the end of this, but rather more of a feedback session and a sharing of ideas. What you will get, however, is a better understanding of how those decisions are being made in a sense of what they're looking at from a data standpoint. First, today we'll hear from Fletcher Tove, who's the Public Health Emergency Preparedness Director of Buncombe County, as well as Felissa Vazquez, who's the Environmental Health Director for the county, who I'm sure a lot of you are familiar with. Then we've asked representatives of industry in each one of these town halls to join us as conversation starters, who may spark ideas or questions you want to pursue. In this case, we've asked Peter Pillay from Persona Cafe to join us, and he's graciously decided to do so. So thank you for being here, Peter. And after that, we'll ask a series of questions and ask you to respond in the chat feature, which will display prominently here. We are recording these sessions, and we ask that you use the chat feature to give your input. That will allow the health department to have a literal record of what you've said. We've done and are doing 7 of these in a 2-day period, so the transcript from that chat will be particularly helpful in the midst of all this information gathering. We will work on publishing a frequently asked questions document, an FAQ document, especially if we don't get to answer all your questions during today's hour town hall. We really want to encourage you to not be shy. Type in your ideas and questions, even if they seem silly, even if they seem like something that is obvious. Please share those, because I can assure you, you have some colleagues who have identical questions. That's what we've seen so far. And we also want to know if these town halls are helpful or frustrating for you. So please share that feedback via chat before you leave the call at the end of the session. We hope that by doing this, we can really identify any community-wide barriers that we need to address, that the health department will have a better context for decision-making about businesses reopening, and that you as an owner or manager will start your preparations for reopening so that you're ready whenever that day does come. I also want to let you know that what we're collecting here today, are ideas. Just because we discuss an idea and like it doesn't guarantee that that's the way things will go in the end. Because at the end of the day, it is the health department's responsibility to determine what ideas provide adequate safety, not ours, even as much as we might like them, like I said. So with that, let's get started. Allow me to introduce to you Fletcher Tove, who's again the Public Health Emergency Preparedness Director for Buncombe County. And Fletcher, the floor is yours. Thank you for joining us again.
Yeah, good afternoon, everybody. Glad to have you here. So I want to start off today and give you guys a snapshot of where we stand as a state and as a county. So last week, Governor Cooper and Dr. Mandy Cohen start off, and they gave us some metrics they're looking at to determine when's the right time to start reopening North Carolina. Locally, we're trying to mimic those metrics with the local data we have, and so we were in line with them there. They also presented their three-pronged approach on their roadmap to a new normal. The three prongs of that include increased testing, increased capacity for contact tracing, and downward trends of that metrics I mentioned earlier. And finally, that gave way for Governor Cooper to discuss his three-phased plan to reopen North Carolina. What that, just generalities at this point, but what he presented was phase one, opening some retail and some aspects of the community, pretty minimal. Phase two, getting rid of his stay-home orders, increasing mass gathering guidance, and relaxing further restrictions on the community into phase three. What I do want to get everybody in the mindset of is that he gave certain time frames he expects those phases to go. Phase one maybe lasting 2 to 3 weeks, and then phase two maybe lasting 4 to 6 weeks to get us to phase three. So I just want everybody to understand that going forward, best case scenario, if the data is where we need it to be and everything goes well, this is something we're going to see phase three happening sometime mid-July. So just have that in your mindset. This isn't a May problem. This is a May, June, July phase to solution we're working towards. Locally, we're looking to closely align ourselves going forward with the governor's guidance. Some of that might include over the next week or two, relaxing some local restrictions that were more severe than the statewide guidance, and to better suit us to fall in line with his phases as he rolls those out. The other thing I want to mention is that we're very aware, painfully aware of the impacts and secondary impacts our decisions have had on the community, local economy, particularly your industry. And I just want you guys to be assured that from the beginning, every time we have a decision-making policy or we're going through that process, that impact is at the forefront of our conversations, and we understand that and we weigh that with the safeguarding public health. We are aware of the sacrifices everyone's made over the last couple months, and we want to make sure that we don't waste those sacrifices by moving too fast and getting ahead of ourselves. We want to be slow and deliberate and make our decisions based on data and science, and that's going to be our plan moving forward. And that's just really what I have for my update, and I'll be around answering some questions later.
Thank you, Fletch. And Fletch, thank you for sticking around. And I'm sure we'll have lots of questions for you in particular. But before we get to that, let me introduce Felissa Vazquez, who is the Environmental Health Supervisor for Buncombe County, to give an update about preparedness for reopening in your restaurants. Felissa. You might need to unmute yourself. Is Felissa here? Oh, there we go. Okay.
Thank you. Sorry about that. So just to start off, I think on the next slide, there's some links that are useful. So the first one has some COVID-19 related guidance, and that includes best practices along with what to do. A frequent question we get is what to do if we have a suspected case within our establishment. So that has some really good guidance on it. The second link there, I'm not going to steal Jane's thunder. I think she's on here too, but that is a great resource. It's comprehensive. So I would encourage everybody to look through that. It has some best practices outlined. And then we are kicking off this week we're piloting it first. So if you're interested, let me know. We want to try it out with some friends first before we push it out to everyone. But we're starting a virtual check-in system. And so anybody who is wanting any type of guidance or it's more of a consultative visit than it is a regulatory visit. Just want to throw that out there. So you're welcome to give us a call and we can schedule you for one of those. Also, if you're going to reopen, we do ask that you notify our department so that we can walk you through what that process should look like. If you've changed any of your processes, we're also available to help you make sure that they're all in compliance, and also point you towards some additional resources and regulations that the state has passed to ease restrictions as far as selling some raw food products. We are also available to help you. Everybody should have an employee health hygiene policy. This is a little bit different than the lodging establishments, but we can help make sure that that is in line with best practices for COVID-19. And then we do want to look at discarding any out-of-date food products, but again, please lean on us because there might be some food products that we can salvage. And then making sure that we're cleaning, sanitizing, and disinfecting. And we can look at your product and make sure that we're using those properly. And then we're also going to ask that you perform a water system maintenance if you've been closed for some time, and that includes flushing out your water system and also looking at your equipment that utilizes water within your facility, drink machines and ice machine, and just make sure that you have gone with the manufacturer's recommendations if that's been sitting for a while. So we're here to help, but we do ask that you call us. If you have any training needs for your staff before you open, we can set up virtual meetings, team meetings, and we can cater it to your needs. So just, a conversation, and we can make sure that your employees get what they need while you've got a little bit of downtime. That's it.
Thank you, Felissa. And I certainly would encourage all of you to take advantage of that virtual or in-person visit to make sure you're properly set up for when things do start to reopen. In addition, I have shared, I know the links there on the screen that you can see, but I've also shared it in the chat if you want to copy and paste it or follow it through the chat feature. The NRA and NCRLA's guidance to reopening with the industry. It's really good. Our friend Jane Anderson at AIR shared it with us earlier. And so wanted to make sure everyone had access to that hasn't already. Up next, I really want you guys to start using the chat feature at this point in time. I appreciate the questions, and we're going to get to a lot of those for sure. But I also want you to start thinking about sharing your ideas and your strategies. A lot of you, and I've read it in the paper and I've been by for takeout, have done some really creative things, and one, marketing yourself, but also ways to stay open, still get some kind of revenue in the door during all this shutdown. So we really want you to start doing some of that now in the chat feature amongst yourselves, and also might be things that we talk about here. But let me introduce Peter Pillay from the Mandara Hospitality Group. Obviously owns a few places, but we know Pasana Cafe here in town. And Peter, graciously appreciate you joining us here today, but would love to hear about some of your strategies and ideas and things you're doing with your restaurant group to try to maintain during this pandemic.
Well, hi, everyone. Thank you very much, Corey, for setting this up, and the other participants. It's great that we are collaborating and getting ideas out there. And the biggest concern that restaurants have is, one, we don't have enough information, and we know things are moving fast, and we know that, there are targets that aren't exactly set in stone that the governor has mentioned, but it's really hard for us to plan on opening when we don't really know when we could open. And of course, everything else that goes in with opening, like even getting enough sanitizer and masks and plastic dividers to protect our hosts and bartenders and other people, because all these things just take time and some things are just out of stock. So, once we get guidelines or more exact guidelines, I think it'll be easier for us, but I also think it'll be difficult for us to get the things that are in hard supply right now. And so first and foremost, I think restaurants, we do want to open. We have been hit extremely hard in this, and we've come through many, many challenging, difficult decisions that we've had to make over the past 5 or 6 weeks, I think it's only been. And, but we don't want to open if it's too early to open. We don't want to put ourselves, our employees, and our guests in harm's way. And we also do want to open the correct way. And we really just need guidance and help in doing that. I know at Pisano, we do plan on reopening. We have been closed for 5 weeks. We do plan on reopening next week for takeout and curbside delivery. And we are going to hopefully do as much as we can contactless. And we do plan on bringing in a plastic screen for our host stand just for the future, because we want to get it now, because when everyone starts asking for them, it's going to take too long to get. And, you know, we just need to think of these things ahead of time so we have them in place. So if it is, you know, best case scenario, soonest case scenario, May 22nd, that I think we could open in phase 2, or push back from there, we're just ready to open and we have everything we need to be able to open properly. But we're putting in, right now for Pisano, we're going to take phone orders only and payment over the phone and package everything up. And then we're going to walk it to your car, hopefully, you know, through the window of the back seat or the trunk. That's what we're going to do. We're going to be open limited hours for pickup, probably 4 to 8 p.m., 5 days a week, and doing meal kits so people could just heat things up at home. We've been doing that at our other restaurant, Bargello, and that seems to be working very nicely for us. So we're going to keep doing that. Another issue we are, and I appreciate someone just mentioned this, is that with restaurants, we pay our employees the best that we can, and some of us have been able to receive the PPP funding and some haven't, and hopefully those other people that haven't can get it in the second round. But we're technically competing with the unemployment office. And that's really hard because we've actually had 3 employees that we've called back to help us open Pisano actually take this time, and they really enjoy being off, and they've actually decided to get out of the restaurant business, so they're actually quitting or retiring. But the employees are getting really good pay from the unemployment office and not having to work. So it is hard to get people back, but you know, that extra money I heard only ends or is only good until July 22nd. So, you know, as far as business owners, you need to decide, you know, sooner or later, there's going to be people that are going to want to come back to work. We're not going to be at 100% capacity. We're not really going to need 100% of our employees that we had before. So you just choose, you know, who's really, you know, ready to come on the boat and help you get through, and take it from there. And also, yeah, what will the demand be from our customers? We just don't know who's going to feel comfortable coming out to eat. I know everyone wants to have some kind of normalcy, but I think a lot of people in Buncombe County, which has been great, I think we've been taking this more seriously and are very concerned about other people's health and not just our own, you know, pleasures that we want to have day in and day out and normalcy that we'd like to have. But a lot of people in surrounding states don't have that same mentality that we do in this town. And they're ready to come back to Asheville, and which is great, but hopefully they don't come back too soon and too many people, and hopefully they don't bring any viruses with them. And then what are our policies going to be to protect our staff? You know, I know the face masks are great. Gloves, do we need plastic shields? And then also that's like, we need to think about if we're technically bringing in our employees into a so-called harmful situation that, you know, they might get exposed to COVID-19 while working. And then what's our liability on that? And the FMLA was, I'm a little sarcastic sometimes, was nice enough to make the demands on independent restaurants even more daunting for us, that we, if someone were to go to a doctor, get a coronavirus test, and then have to be in quarantine, we need to pay for their paid sick leave while they're in quarantine. And if then when they do a research and they start contact tracing, and if they've been in contact with other restaurant employees, and now those restaurant employees have to go into quarantine, and then we have to pay their quarantine for 2 weeks as a paid sick leave, which is very nice, but that's not what we had to do under the old rules or before COVID-19. So we need to take that into account also. And then also, just to throw this craziness out there, even though most of us use local processors and local farmers, and the processing of the meats in this area, it seems like processors are still doing very well and don't have to completely shut down like all those horrible stories we hear about the Northwest and the upper Midwest. But then also our food supply. Can we get safe food? Can we get enough of it? Who's even producing food at this point? So there's a lot that goes into us being able to open safely. And it almost seems like a daunting task for us. And I know I probably haven't even scratched the surface of what other restaurateurs are thinking of also. So the more guidance we have, the more collaboration we have is great. And us together as a team and as an Asheville Independent Restaurant Association, discussing these things to figure out what is really the best way for all of us to proceed. And we all are going to have little differences, which is fine. But I think just knowledge is power, and we just need as much knowledge as we can, and also as much guidance from the health department and also from county health and the governor of what is expected of us, and how we can open safely, because that's all we want to do.
Right. And thanks for all that, Peter. I'm sure your sentiments are very much felt in this room at every level and every issue that you discussed and broached upon. I can speak to the federal portion of the unemployment, which makes it kind of a handsome unemployment, so to speak, right now, is the extra $600 a week. That phases out on July 31st. So as of right now, there are no plans to extend that. So that's when that ends. But I certainly hear your call there, and I think a lot of people in the chat feel the same way. The other thing I'll direct everyone's attention to in regards to employee and other good guidance for business and safety is the link that Ellis Vaughn from Buncombe County Health and Human Services just posted. That's a really good one as well that you should use as a resource. Let me turn back to you, Fletch, about some of these questions in regard to phasing. I know this is a really popular question and issue in our last conversation about lodging and hotels. Where do restaurants fall in the phasing categories? And what about like a bar or restaurant that has outdoor seating, maybe as compared to some that won't, but would there be a separation there of any kind, and where would they be included in that?
Right. So looking at the governor's guidance that he put out last week, and again, right now that's very general. It's really just the framework. Restaurants are set to resume operations with phase 2. And then phase 3, I think the language used is to expand or loosen restrictions for restaurant operations. I saw a question, the language the governor's using is restaurants, bars, and breweries. I think that would all work together. So again, the phasing, if that's phase 2, I'm not sure if he's going to have some stipulation for outdoor dining before that, but we're anticipating his guidelines for phase 1 when we meet that criteria are 2 to 3 weeks before phase 2. Talking about PPE for you guys. So one thing I've clarified with all the other town halls we've done recently is just some of the language we're using. We're being very specific at the county and public health, talking about the difference between masks and cloth face coverings. When we talk about a mask, we're talking about like a surgical mask or like an N95 respirator versus like a cloth face covering, which can be anything from a bandana to a folded t-shirt to some of the home stitched ones we've seen. we still have a national shortage and scarcity of medical PPE, those masks and stuff, and we need to conserve those for first responders and healthcare workers. So that's why our local guidance, the state guidance, and the CDC guidance all recommend using those cloth face coverings. The benefits of those are twofold. One, it preserves true medical PPE for the industries that need them. And two, they're washable. So you could have one, you have two, one for one day, wash it, use the other one the other days. And then it allows you to use them for weeks and months at a time versus the traditional PPE that might save its form and function and integrity for a week or two, but it's going to fall apart. And as a nation, as we start reopening and burning through those, we're going to have another run in scarcity on those. So the guidance we currently have, same as the state, are strong recommendations for those face coverings whenever you're out in public. As far as other face shields and stuff, we're working locally to procure not only the face coverings, but more face shields through the Emergency Operations Center for everyone. We're working to establish our own guidelines, but what we're really hoping for is this week or early next week, some more specifics from the governor about what the nuts and bolts of those phases look like. So specifically in phase 2, to what extent restaurants can open and bars, and in phase 3, how they'll relax. Because we understand that just because the governor says, you could open up at, for example, if he says 50% capacity or something like that, that doesn't necessarily mean financially it's a smart decision to make at that time if you're at a limited capacity. So we're just waiting to see what the governor's guidance is on that, and where he goes from phase 2 and 3. As far as the FMLA and unemployment, that's a little out of public health's wheelhouse, but we understand the considerations there. Yeah, and so the name of the game for the rest of the year is going to be physical distancing to the best extent possible and some kind of face covering. So that's not going to go away, but things like the plexiglass shields, when you can place them, will help. And yeah, so as the governor's guidance comes out, we're going to digest that, kind of put a local flavor on it, but to the best of our ability, be aligned with what he puts out.
Yeah, thanks for that, Fletch. And if we can move to the next slide, we really want to encourage you all, and you're already doing this wonderfully, and we have a lot of subject matter experts in this room right now. I really appreciate all of you being here. But please feel free to share more ideas or strategies that you could really benefit from in reopening. I see that Ellis answered one specific question there about exposure and quarantine, so that's great. There was another question I wanted you. Ken answered a question about curbside pickup and working with the city about allowing for some parking, freeing up some parking. I know that the mayor's in here as well. They both have commented in separate town halls that there are conversations going on about that, and hopefully they'll be able to work something out to benefit all of our local restaurants in that regard. There was another question. I can confirm that Chuck McGrady is specifically working on something to assist with our bars and distillers and others about curbside takeout for cocktails and things like that. So that could be a possibility coming from the General Assembly. I failed to mention at the beginning, they did go into session today. There is money sitting in the Treasury account right now of the state that came down from the federal government that they are looking at ways to dole out to assist local businesses, to help with our hospitals and healthcare workers, as well as our local municipalities and county governments. So those conversations are being had, and we've been tracking that very closely and do our best to keep everyone up to date as much as possible, and obviously advocate as strongly as we can for Buncombe County and West North Carolina businesses. But please feel free to continue to share those ideas as much as you can and thoughts that you have there. I don't know if did you have anything you wanted to add there, Fletch, on those issues?
Yeah, I've seen some questions pop up. I'll try to address a couple of those.
Okay.
But one, there hasn't been specific guidance for back of house staff this whole time, as you guys have been doing curbside stuff. So I don't expect when we're talking about face coverings and things, I don't expect that necessarily to extend to back of house in the governor's guidance. Also, I use the example of 50% occupancy just as an example. We don't know what the specifics of the governor's guidance regarding restaurants will be in phase 2 and phase 3, but I just use that as an example. As far as the timeline for when we get those specifics, we're hoping by the end of this week or early next week, we'll see the next iteration of that plan where we get some more detail about this, how phase 2 actually works and what that means for your restaurant limitations or how they operate, and then how that will change the phase 3. So hopefully in the next week or two, we'll get those specifics. And our plan, as we get those, again, I said, digest those, put together a comprehensive messaging campaign for the specific groups, and then turn all that guidance into a cohesive, comprehensive community campaign that tries to answer everybody's questions, not only you guys, the owners and providers, but the public as well. Because as you guys discussed earlier, Peter, just because you guys are open doesn't necessarily mean the public's going to feel safe and comfortable coming out. So part of that campaign is also making the community understand the measures we're taking, the measures that have been implemented for you, and communicating that consistently across the community to give everybody that understanding and information.
Yeah, and I think that you hit the nail on the head, Fletch. It's going to be a community-wide campaign across all industry, all levels of our community, about communicating, amongst ourselves about what's safe and what we need to be doing to make sure we're safely reopening, but also communicating that message to the outside world about what to expect if they come to Asheville, Buncombe County to dine or stay or visit. So I think that's really important. If we could go to the next slide, please. I think something that we want to talk about here, of course, we're sharing ideas right now, and that's great. And that's the meaning of this. And really to help you all start thinking, which I know you are, but really start thinking about what you need to be doing right now to prepare so that you can reopen when the phasing in starts. And so something that we really would like to know and something we want to share here is what kind of resources are needed for you to provide those services, and what kind of things do you need access to that you can't currently find or don't know about, that we can help try to get you in contact with or help provide to you or have the county provide to you. So I would love to see some responses about that, as well as Fletch, I know there was a question earlier and we've had a lot of comments since then, so I'm not going to try to scroll up and find it, but I know people are looking for best resources for PPE equipment, safety equipment. Peter says he's having issues finding some things as well. So I'm sure that's a common issue. So where can people go to find those things?
Don't really have a good answer for that right now, as I don't expect the governor to put more stringent requirements on you guys as far as like face shields and everything. But I do expect some front of house face coverings, the same. We'll have to wait and see what his guidance is, but I don't have good answers on where to get PPE right now.
Right. I think there was a link that was shared earlier that can help you, but that's a national link, but certainly look into that.
I do know locally there are a lot of great local people doing those hand sewn masks, and right. You can find those all over town.
And we have some excellent, nimble industry partners too, as well as distilleries who are making hand sanitizer, which is awesome. So certainly support those companies if you can, and we'd like to see that. Thank you for that, Sandy. I'm sorry. So supplyconnector.org, that's the website I was trying to think of. That's the one that I would like to make sure people go look at that.
I'm seeing some questions pop up about screening. So let me talk about that for a second. So as we reopen or as you're working now, screening is absolutely a best practice. That involves, asking a series of questions, and we can provide resources for this, but about primarily symptoms and how they're feeling. We get a lot of questions about taking temperatures. If you have the resources and materials to take temperatures, you can do that. But there are a couple shortcomings of that I want to address right now. One is that we know possibly 50% to 75% of people who have COVID will never show signs of a fever. So that's, while that would help cut down some numbers, it can possibly give people a false sense of security. Somebody who might maybe be feeling a symptom or two, but see that they only have a 98 or 99 temperature, might think, oh, I don't have a fever. I'm not at risk. So we want to make sure we message that clearly, that taking a temperature can help, but it can't be done in isolation. It has to come with a series of symptomatic questions. And for screening, you should be doing that daily with your employees. Some things we've seen different people do is some people actually have employees come in and do a paper screening form every day and fill that out. Some people have kind of like a social contract that they've signed that when they come in and check in for the day, they're affirming that they don't have any symptoms and that they're, feeling well enough to work. There's even some technology that people are having their staff download apps, and that will prompt them the night before to report what their symptoms are. So there's solutions for that, but screening is definitely a best practice. We just don't want people to get overly focused solely on the temperature aspects. That needs to be comprehensive screening. And we get I see some questions about that format. I don't know, Ellis, if you have that, if you can share that, or we'll be sure to get that out to the group, some screening resources.
Right, that's great information, Fletch, and good distinction. I know we've had to make that distinction often. You made a distinction earlier about the difference in the mask? Did you do that on this one? I'm trying to recall.
Yeah, I think I did.
I thought you did. I was pretty sure you did. I just wanted to make sure because that's another pretty big distinction that we've been trying to make for folks. So I know folks are sharing some resources and asking for those. That's great. That's stuff that we can provide currently. But what are some of the gaps in the current guidelines that folks are seeing? I know timeline's obviously one of them, and we can't give a specific date right now as much as we would love to. We're certainly staying in close contact. I know the county is as well with the governor's office. And the second we have more of a tight window that we can give folks to start with these the phases, that we certainly would do that. But are there other gaps in the current guidelines that you have questions about? Things that you would love to see and have answered so that it provides some clarity to you based on what we currently know. Obviously, we can't predict what's coming in the future. But what we currently know, what are some current guideline issues that you're seeing in your business, specifically in regard to restaurants probably and bars and breweries? Are there things that you want to know about or don't have any clarity on? Would love to see some things about that as well. So I know there's guest requirements for square footage requirements for guests in certain businesses. Fletch, is there anything out there specifically regarding the restaurants and the like?
I haven't seen that. The governor put out a couple of weeks ago via executive order limitations on capacity based on fire code, building occupancy, or like a 5 per 1,000 square feet. I haven't seen anything for restaurants. I don't know what criteria the state's looking at, but again, that's something we hope to see later this week or early next week, so we could help you guys in your planning process and know what that'll look like.
Let's see. Do we expect our guidance here locally to be more restrictive than the state? Fletch, I know it's been sort of the way the approach has been so far from the governor, correct me if I'm wrong, has been to sort of give a baseline and allow for localities to be a little bit more stringent as they see fit and as their curve has or hasn't.
Right. That's a really good question. So far, we've in several areas been more restrictive than the governor, and that was specifically done because we thought we were approaching some windows of criticality where the state wasn't where we needed to be to flatten that initial surge. So we've had some areas where we have been more restrictive. We've had some discussions lately, and we're trying really hard going forward to be more aligned with the governor's guidance. So that means over the next week or two, we're going to be relaxing a couple measures where we've been more restrictive to fall in line with him, so that when he gets to phase 1, we'll hopefully be able to sync up there pretty squarely. Just it keeps communications easier. It keeps people from getting confused from differing guidance. That being said, though, is if we see things coming from the governor that aren't in the best interest of Buncombe County, that we may be restrictive again. But I just if we're doing that, it's because we have the best interest of the public health in mind. But our intention is to, from going forward, align with the governor as closely as possible. And about that, I see a question about Henderson County. So yeah, our health directors, our networks are reaching out to particularly neighboring counties, because we understand if one county does something different, like maybe everybody's going to run down to Henderson County or Haywood to go eat or go to get their haircut or whatever. So we're doing our best to coordinate a regional approach. And that's one thing refreshing coming from the state, is that it seems like we finally have the comprehensive, cohesive statewide strategy that we've been asking for. So I think that's going to help get rid of those differences between counties that may cause some consternation for everyone.
Yeah, I think a regional approach is particularly helpful and vital for us in West North Carolina. We're just a tad different up here, and our economy works a little bit differently than it does in the Triangle or Charlotte or even the Triad. So I think having that communication is absolutely vital, and we certainly were supportive of that as a region. I saw a question about percentage of downtown restaurants doing takeout. I don't have those numbers specifically, but what I can tell you is that the Asheville Chamber a few weeks ago, and a lot of people on this call participated in a community-wide survey over the entirety of Western North Carolina about COVID-19 impacts and response in your business. You can go on our website at ashevillechamber.org/coronavirus, and you can look at those results live. They update live as it gets filled out. And you can find out what restaurants are open, which ones are closed but doing takeout or delivery. And you can narrow that down. I don't know if we have it to where it's set to where it can go to downtown. I'll have to ask our staff about that, but I know you can certainly narrow it down by county and get an idea for the takeout numbers there. In addition, and while I'm talking about it, I want to plug that we're now doing a second round of surveys. It's on that same website that you can now go, even if you filled out the first one, I encourage you to fill it out again. Please go there. And what that one is more aimed at is the impacts of the SBA program, the PPP program, and any other resources that you may have access to or that you've tried to get and can't, to try to get a good idea of how those have impacted us here locally, so that we can take that information to policymakers and decision makers to try to fill some gaps at the state level and locally, as well as continue to advocate for y'all at the federal level. So please do that. And while I'm thinking about it, go check that website out and check the survey out. But you can get some information there about what you asked there earlier. Let's see.
I've seen a couple questions about face coverings in general, I think. So the way Governor Cooper's planned phases are worded right now, it seems like he's not going to mandate face coverings. They're just going to be a strong recommendation. That's what we have currently in the county. I have seen through some of the other 4 or 5 town halls we've done over the last day, is that from the business owners and community, there seems to be a lot of people asking for, to have a clear mandate that those are required. Try to poll this group real quick, just to what your feelings are about, I'm not talking about your staff necessarily at this point, but just in general for like downtown Asheville and Buncombe County in public. What do you guys think about face coverings? Because I was surprised at that response from some other of the groups. And then see if any other questions as far as immunocompromised staff. About pay leave and stuff like that. That's a little out of public health's wheelhouse, but we could definitely bring that question to some leadership's attention. And Peter, I think that's what you said about not allowing people at the bar. It's a good example of a little step we can take internally inside the buildings. Yeah, so exactly. It's a different ballpark for restaurants where people can't necessarily be shopping the whole time with a face mask on.
Right. Yeah, it's sort of a different ballgame for restaurants when it comes to that. But I think, at the same time, there's going to be a lot of people making their own decisions, as in the public, about whatever phase we're in, if we're fully open, whether it's still safe for them based on their own health history, their own exposure, whether they should be out and going to restaurants or not. So we can't solve every problem on our own. Like people have to make those personal choices as well, and we'll be making them going forward. I know a lot of folks will. So I think that's something that we certainly have to take into account, even though we can't necessarily predict, as we've discussed. Fletcher, do you have any closing comments or anything? Otherwise, I'm going to give a summary and some instructions here.
I would just like to reiterate, thank you, everyone. We're capturing everything, all the questions we didn't address as we, put together our local plan. Really, once we get more guidance from the governor, we'll be sure to put that together and push it out to everyone. I just want to reassure you guys that as we're going through these decision-making processes, we're having the conversation about the impact and, restaurants specifically every time we have one of these conversations, and we're trying to do the best for everyone. So I just want to reassure you guys about that.
Certainly, and thanks to you guys for being considerate and taking all those things into account. Thanks to there are a lot of experts that have been in this room and have been making comments throughout for their input. And I know they're all advocating both locally and at the state level. So thank you for that. I want to encourage you to continue to put questions and comments into the group chat. We'll leave it open for a little bit because again, this will be recorded. It will be taken in for data collection and analysis by the county. So please continue to do that. In addition, feel free to give feedback as to whether this town hall was helpful or not. Hopefully it was hopeful, but hopefully it was helpful too. And we'd love to hear whether it was something that you got something meaningful out of or not. We'd ask that you would send any other questions or comments after we're done here to the email there listed on the screen, business@buncombecounty.org. So you can continue to follow up, if 5 minutes later after we've closed out, you're like, oh man, I should have asked this. Feel free to do that. I would encourage you to do that. In addition, I'll plug the survey again. Please go to ashevillechamber.org/coronavirus. As again, we'll try our best to take that information and use it when we lobby and talk to and advocate for you to our local elected officials as well as our state and federal. I think certainly throughout all this, again, as I said earlier, it's been really encouraging to see how much innovation we have here in Asheville, Buncombe County, how much resiliency we have, and certainly together as a group, we are more resilient. And I want to thank you all for sharing your collective wisdom with us today, for your input. Thanks to our partners in local government, state, city, and county level who are working to keep us safe and healthy. Thank you, everyone, and please stay safe out there and let us know how we can help. Thank you.